I think we should start this now.
Right. Good afternoon all.
लिंक चालू कर दीजिए भैया YouTube वाला.
उस लिंक में कुछ टेक्निकल प्रॉब्लम आ रही है, वो नहीं हो पा रहा है.
नो कोई बात नहीं. फिर यहाँ से रिकॉर्डिंग कर दीजिए आप चालू.
हाँ जी, रिकॉर्डिंग स्टार्टेड है. So good afternoon everybody. My name is CA Ashish Gupta on behalf of the Chartered Accountants Forum. First of all, happy Independence Day all of you. And before further intro, I would like to request to all of you to please stand up, and we will play a short video of Jan Gan Man, our Rashtragan. I am going to share my screen for that. I think my screen is visible, right? Ashish sir, my screen is visible?
Yeah, it's visible.
Okay, I'm going to start. Is it audible, right?
Yes, audible.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उज्जल जगति तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Hello.
Now I request. Hello, am I audible?
Yeah.
अब मैं रिक्वेस्ट करूंगा हमारे सीए फोरम के प्रेसिडेंट मनोज कुमार पटावरी जी से कि फर्दर हमारे वेबिनार और हमारे स्पीकर के बारे में बताएं हमें. सर, ओवर टू यू.
Good afternoon, everyone. It's a real pleasure to be speaking on the occasion of this Happy Independence Day. I welcome Dr. Rahul Chandola Saab, who is a very senior heart specialist and transplant surgeon at Max Hospital, and CA R.K. Kila Saab, जिनके कारण या जिनके सजेशन से आज ये हो पा रहा है. और समाज सेवा तो कोई आर किला साहब से सीखें. ये he also manages the एम्स के बगल में एक काफी बड़ा विश्राम स्थल है. उसमें पूरे फूड का कंटिन्यूअस राउंड द ईयर फूड पैकेट्स भी ये डिस्ट्रीब्यूट कराते हैं एम्स के सामने, सफदरजंग के सामने, आरएमएल के सामने. डॉक्टर, अब मैं ब्रीफ बताऊंगा डॉक्टर चंदोला साहब के लिए.
मनोज भैया एक बार आप म्यूट हो गए हैं, आप अनम्यूट कर लीजिए प्लीज.
अच्छा, अब कहाँ से मैं ये भी हुआ था कि कुछ सुना है, मेरा नहीं सुना है.
जी का दोबारा बता दीजिए आप एक बार.
किसका?
जो आप इंट्रोडक्शन देते हैं वो दोबारा दे दीजिए.
अच्छा, दोबारा दे देता हूँ. तो डॉक्टर राहुल चंदोला is a senior heart specialist and transplant surgeon at Max Hospital. He specializes in the treatment of complex heart diseases and also heart and lung transplantations. He is one of the most highly trained heart specialists in the country and has gained experience over many years at the North America at Toronto General Hospital, Sunnybrook Hospital and University of Alberta. He has done more than 10,000 heart operations, which included bypass surgeries, value surgeries and aortic operations, and more than 250 heart and lung transplantations. Dr. Rahul was also program director for the heart and lung transplant program at Global Hospital, Chennai. It's a real pleasure for us to welcome Dr. Rahul Chandola for this webinar, who has taken out time from his busy schedule for this program. And I also like to introduce Ashish Kila, who is himself a person to talk of in the field of wealth management, and who has also consented to become the moderator for this program or the webinar of Dr. Rahul Chandola. आर्य किला साहब के बारे में भी मैंने बताया था, शायद सबने उस टाइम म्यूट हो गया था, नहीं अगर हो गया तो मैं जरूर चाहूंगा कि एक बार रिपीट करूं। मैं कहूंगा कि समाज सेवा आदमी आर्य किला साहब से सीखे। ही इज एम्स के बगल में काफी बड़ा विश्राम स्थल है, उसको भी कंप्लीटली यही मैनेज करते हैं। साउथ दिल्ली के अंदर में एक सीए स्टूडेंट्स के लिए भी गेस्ट हाउस रन करते हैं, और एम्स, सफदरजंग एंड आरएमएल के सामने रेगुलर फूड पैकेट्स डिस्ट्रीब्यूट करते हैं। एंड इट्स रियली हैट्स ऑफ टू हिम फॉर द सोशल सर्विसेज ही इज रेंडरिंग, एंड ये उन्हीं की बदौलत या उन्हीं की राय से आज ये हो पा रहा है, तो वी आर आल्सो रियली थैंकफुल टू हिम आल्सो। सीए फोरम के बारे में मैं एक ब्रीफ, हालांकि 2 सेकंड लेऊंगा। सीए फोरम इज अ फोरम of the chartered accountants, where all the members are the chartered accountants, and which does all the works related to for the upliftment and support for the chartered accountants. So, and any chartered accountant can become a member of this forum by logging on to the website of the CA forum, and he can follow the guidelines there and become a member of the CA forum. Now it's over to Ashish to take the things forward. Wish you all the best.
Thank you so much, Manoj bhai. Thank you so much, CA Forum. Would like to invite our India chairman for roundtable, Mr. Naveen Kejriwal, to please say a few words about roundtable. Naveen bhai, will you unmute yourself?
Yeah, hi. Good evening, everyone. It is a pleasure to have all of you joined in this LAPD session, wherein Dr. Chandola, who is so experienced and a great surgeon, would be giving us enlights about the problems related to COVID and heart issues. So I would like to thank firstly to the CA Forum and Perfect Foundation, especially Ashish, to come forward and organizing all this. So we Roundtable India is a organization, NGO, that is a youngsters organization which comprises of youngsters from age 18 to 40. Like 40 के बाद हम automatically retire हो जाते हैं. So it's like एक young dynamic entrepreneurs हैं, जो businessmen हैं, who wants to serve something to the society, are part of this organization. We are a zero overhead organization. हम जो भी fund raise करते हैं वो हम अपने ऊपर यूज नहीं करते. मतलब अगर हम कोई भी समाज से कुछ भी पैसा उठाते हैं तो that goes for the betterment of the society. So what we do is, our primary motto is freedom through education. So we at Roundtable, we build almost 1.5 classroom every day pan India. तो अगर हम लास्ट ईयर की बात करें तो हमने 7700 क्लासरूम बनाए हैं एक साल के अंदर में, और टिल डेट 50 लाख से ज़्यादा बच्चे अंडर प्रिविलेज राउंड टेबल इंडिया और उनके जो जुड़े हुए संस्थान हैं, वी हैव CSR पार्टनर्स जिनकी मदद से हम क्लासरूम ब्लॉक्स बना के देते हैं गवर्नमेंट स्कूल्स को या जो भी नीडी स्कूल्स हैं, वहाँ पे 50 लाख से ज़्यादा बच्चे आज के दिन निःशुल्क पढ़ रहे हैं. सो दिस इज़ व्हाट we at Roundtable India have been doing. Apart from that, we keep doing other social works जहाँ पे we have cataract operations, we try to serve the society, old age homes, orphanages, different गरीब बच्चों से related बहुत सारी ऐसी एक्टिविटीज़ है जहाँ पे हम अपने तरफ से जो बन पड़ता है हमारी बेस्ट ऑफ द कैपेबिलिटीज़ में we try to serve the society. So as of now, like हमारे 4,500 से ज़्यादा एक्टिव टेबलर्स हैं पैन इंडिया, और हम 120 से ज़्यादा शहरों में हैं, और आज के दिन 347 चैप्टर राउंड टेबल इंडिया के पैन इंडिया हैं, एंड इट्स अ इंटरनेशनल ऑर्गेनाइजेशन स्टार्टेड फ्रॉम इंग्लैंड, और आज के दिन जो है पूरी दुनिया में जो है राउंड टेबलर्स जो है दे आर सर्विंग द सोसाइटी नो मैटर without any kind of personal interest and just for the betterment of the society. This is all about Roundtable India. Thanks a lot. Over to you, Ashish, and thank you again, Dr. Chandola, for having.
Thank you so much, Naveen Bhaiya. Our third partner NGO today is Perfect Foundation, which is the community service organization for Perfect Group, and is following the ethos given by our founder chairman, Mr. Arikila, and we are advocating social responsibility beyond the checkbook. And we are focusing mostly on health, literacy, and vocational education by empowering the youth with skills and mentorship, and focusing on how to bring more entrepreneurship, more literacy, and health initiatives with everybody. Thank you so much for all the partner NGOs today, CA Forum, Roundtable India, and Perfect Foundation. I would now like to hand over the session to Mr. Chandola to please enlighten us with today's interesting topic on heart health, which is something very important. Rahul Bhaiya, please.
Sure. So should I start that screen share?
Yeah, Bhaiya, please start the screen share.
Sure. So before I start, I'm really happy to be part of this program today, and really happy that so many good deeds are being done by Roundtable India. The description was quite phenomenal. I'm quite floored. 7,700 schools last year. It's phenomenal. So and I also understand that you also have interest in the health. Education and health are probably the focus of your work. And to be here today, delivering something which is really, really so important to maintain our healthy lifestyle. Heart is something which is the seat of the soul. That's been there. Like our sages have told that heart is the seat of soul, and truly so. We know that the heart is so important organ in the body. And unfortunately, the layman has little knowledge about the heart, and especially what needs to be done to maintain a healthy heart is less known to the public. So I'm here just to share some pearls, about how to keep your heart healthy, and especially this COVID times are quite stressful to everybody. Talk of anybody, right from top to bottom, everybody is stressed out. These are stressful times. First, the fear of death, fear of contracting the disease. And second, the business is being affected by it. And believe me, any profession, is equally affected with COVID. People say that doctors are probably not affected because, COVID patients are there, hospitals are full, but it's not so. I can tell you everybody is affected equally. So to maintain healthy heart in these stressful times is so important, because stress is one thing that affects the heart so badly. We have seen so many patients coming with the MI who did not apparently have any obvious comorbidities. Patients without any history of hypertension, any diabetes, any thyroid illness, lung illness, young patients, 35 years of age, and presenting to us with a heart attack, and some of them actually having a fulminant heart attack, difficult to salvage. So So these are stressful times, but again, I think there is great hope, and hopefully we should be over with these times very soon. So I'll just start with, and I'm really thankful to the CA forum, specifically Mr. Ramatar Kila Sahab, Ashish, who has taken a lead in inviting me. And thank you so much. I'll just start without taking too much of time. I am a heart surgeon in Max Hospital, Saket, and most of my training has been in India, in Delhi itself, Banaras Hindu University, then in Toronto, Alberta, and Berlin. So this was basically, I specialize in all kinds of heart operations, heart interventions, and heart lung transplants. So next slide. Slide is not moving, I think. Yeah. So here you can see what causes the heart attack. We just need to know that before we start the healthy heart tips. And you can see this is the blood vessel as it is shown here. This is the blood vessel here, and this is the cross section of the blood vessel to the heart, and that shows a yellow colored plaque which gradually builds up in the vessels, and this causes obstruction of flow to the heart vessel. This is the vessel, this is the artery that supplies the heart muscles. So this is blocked by the buildup of cholesterol plaque. So this plaque gradually builds up as the time goes on, and ultimately it causes obstruction, critical obstruction of the vessel. So once the vessel is obstructed more than 70%, it remains at high risk of having sudden blockage. And the sudden blockage of this heart because of the rupture of this plaque. So what happens is this plaque, because of any stress, because of hypertension, it can rupture anytime. And once it ruptures, there is accumulation of blood cells inside, lots of clots that develop here, and that cause sudden obstruction of the vessel from 70%, 80% to 100%. As a result, the vessel does not get any blood supply at all. So the part of the heart that is being supplied by this vessel does not get any blood, and it dies, starts to die. This is what we call as a heart attack. And once the heart attack happens, then there are ways, there are methodologies, and that have to be followed by the patient as well as by the medical team to mitigate the further complications. Now, so as we know that this is the leading cause of death in 21st century, no other disease causes that many deaths as the heart diseases. Cardiovascular health is so important. And 50% of people who die of heart attacks do not have any preceding symptom. This is such a common thing that people come to us with the heart attack, and they are often surprised. How can we get heart attack? We didn't have any symptom at all. We didn't have any comorbidities. We are young. We get patients as young as as young as 30-year-olds, who come to us with a heart attack, and obviously they do not have any preceding symptom. So 50% of the patients who die of heart attacks do not have any symptom before. So atherosclerosis generally happens, it starts to build up, the plaques start to build up even in the childhood, and gradually they advance as the age advances. There is a trend in our country, specifically in India, Southeast Asia. We have got a little aggressive coronary artery disease. So the plaque buildup is even more, and the trend is seen at a relatively early age. So for example, like in North America and Toronto, we used to see people coming with the heart attack with the age, like 50s, 60s, 70s. Here we see even the younger patients. And I can tell you, I have done bypasses in the West. We used to do the bypass for, say, the patients who are in their 50s, 60s, 70s. But here in India, I have done a bypass for a 21-year-old child. So you can imagine, the severity of the disease, the magnitude of the problem. Now, so this is what a coronary artery disease means. The coronaries means the heart, the vessels to the heart, the arteries to the heart, that often get blocked and lead to heart attacks. So that is called coronary artery disease. So as you can see, there are multiple factors leading to coronary artery disease. Important ones amongst those are smoking. It's a bad thing, if you think about the heart health. Obesity, bad thing. Stress is really bad. That if there is a family history, like one of the parents have a history of heart attack, that's a bad thing. Age, of course, anybody who is more than 40 years in age, they should get a heart checkup done. Then history of diabetes, history of hypertension, and high cholesterol. These are certain things, certain risk factors, which in isolation or in combination can cause the buildup of plaque in the coronary arteries and ultimately lead to heart attack. So these are certain important things, and our talk will revolve around these multitude of factors. So MI, as you can see, this is the bar showing the percentage of patients whose first diagnosis is heart attack or death. In men, as high as 62% of the patients, whose their first diagnosis is a heart attack or death. In women, close to 46% of the women will have the first diagnosis as heart attack or death. What that means is without any preceding symptom. So you can see the deaths from cerebrovascular disease, the cardiovascular disease. The conception is that the concept is like we talk to any layman, they will say that more people die of cancer as opposed to a cardiovascular illness, but that's not true. Actually, much more people die of cardiovascular disease as opposed to the cancer. So you can see here. So on the left side, you can see the perceived health threats. You see that the perceived one is that the cancer causes 55% of the, cancer is responsible for 55% of the deaths. But actually, and the heart disease constitutes 22%. This is a perceived. If you take a survey, this was a survey done in 1995. And the people thought that only 22% of the people die of heart attack or heart-related illness. But actually, it is the 46% of people who have got coronary artery disease. And you compare that to cancer, which is 24%. So it's the opposite, So it's not the cancer, it's the cardiovascular health. That is the major concern. So prognosis, I'll just skip this. So what happens when a patient with coronary artery disease is detected at asymptomatic stage, when you don't have the symptom, or just when you start to have the chest pain, So we know that there is a 99% survival if this chest pain, is reported, So 99% of the patients who will report at the stage of angina, the chest pain, they will go on to survive. So what we do is we do the ECG. Once you have the chest pain, you get the ECG. More often than not, in ECG, half of the times ECG will show some changes, and more often than not, it will not show any changes. Especially when you're not having any pain at that time. So what we do next is, if you have chest pain, you go to the doctor. He'll do the ECG. If there are no changes, he will advise you a TMT. TMT is a treadmill test. So we will ask you to run on the treadmill and then see, when you exert, do you have any changes at that time? Like at rest, you are not having any changes in the resting ECG. But while you exert, are there any changes? And if there are any changes, that means that there is a blockage present there. And that needs to be investigated further by an angiography, So echo is done to see the heart function. And ultimately, gold standard is if you're having chest pain, if you have changes on the TMT, your doctor will ask you to go in for an angiography, where a dye is injected into the heart vessels, and then we see the course of the arteries. All three arteries are seen nicely with the angiography. And if there's a blockage, you know what needs to be done. If it just needs a medical treatment, or it could need a stenting, or if the blockages are severe, multiple blockages, more than 2 blockages, then in that case it's a bypass. So it all depends, what the angiography shows. That's why angiography is the gold standard in diagnosis of coronary artery disease. Now, the ultimate thing for which we are here today is to discuss about the prevention. I think the prevention is the ultimate cure. And especially in case of heart, it needs drastic changes in the habits and lifestyle. First of all, you have to be aware about the heart disease, which we did in the previous slides. Awareness is very important that heart disease do exist, and people are so vulnerable. Then the changes in the habits and lifestyle and early detection in the asymptomatic patients is important. So how do we do that? I'll come to that. Now, lifestyle modification is the so important. We will discuss later on how do we modify the lifestyle. The control of blood pressure. We know that heart disease, as I showed in the first couple of initial slides, hypertension plays a big role in the development of coronary artery disease. So if you control your blood pressure nicely, you take that blood pressure 130/90 as the cutoff. If the higher side of the blood pressure, systolic pressure, is more than 130, or the lower pressure, the diastolic pressure is more than 90, you should seek advice, and you should try to keep your blood pressure below that range, because if it goes more than that, it causes unnecessary pressure on the heart that leads to development of heart disease, coronary artery disease. So second thing is the treatment of your dyslipidemia. What that means is high cholesterol, as we call in the layman terms. So if the cholesterol levels are high, triglycerides are high, as shown by the lipid test, that we do, the cholesterol testing. If you're found to have, high levels of cholesterol in your blood, that needs treatment, because this cholesterol gradually builds up in the coronary arteries and leads to plaque formation, NMI. Then another important thing is in patients where the high cholesterol, initially for the high cholesterol, we will recommend the exercises, stress relief exercises, lifestyle modification. If that doesn't help, then in that case, anti-atherosclerotic therapy is started, and hypolipidemic therapy is started in these patients. There are medications that can bring down the cholesterol over a period of time and prevent the buildup of plaque in the arteries. And the other thing is in the diabetics, they have to be really, really careful about controlling their blood sugar. High blood sugar leads to plaque rupture and ultimately heart attack. So smoking, very important. People do not pay much heed to, the advice about quitting smoking. But importantly, smoking is, so the risk of heart attack increases twice, twofolds with smoking, in people who smoke as opposed to those who do not smoke. So it causes 35 to, like the ischemic heart disease causes 35 to 40% of all smoking related deaths, So what that means is the people who die of heart attacks, 35 to 40% of them have a history of smoking, so you can understand how bad is the smoking for heart. So and as soon as you stop, the good part about the smoking is as soon as you decide to stop smoking, within months the risk and mortality because of the smoking will come down drastically, as drastic as 36%, and probably in a year to 2 year time the risk will go further down. you know. So smoking cessation is a very important part of the lifestyle modification. So now, what about the alcohol, you know? So people say that little alcohol is good for heart, maybe, but we do not know how much is good for heart. But the alcohol also gives you those empty calories, you know, and those calories are not good for the heart. So it is a myth that, you know, people who drink more, you know, it saves them from heart attacks. Obesity is a silent killer, you know, especially prevalent in our Indian population. You know, people are, you can see, like in the North Americans, in the European population, you know, they don't have the belly fat as much of a problem as in Indian patients. The Southeast Asians have got the belly fat more prominent, you know, and this is a specific problem with the Southeast Asian people, you know, that tummy, you know, that tummy needs to be in, and that happens because of because of sedentary lifestyle, overeating, not eating the right food, and not exercising enough. For men, you know, if your waist is any more than 40 inches, you know, it's not good. So you have to aim to keep it less than 40 inches, and you have to aim to keep your body mass index, you know, this is calculated based on your weight and height, you know, and the body mass index should be less than 25, you know, in a normal person, and the waist circumference should be less than 40 inches in men and less than 35 inches in women. That should be the goal. Now, for a healthy heart lifestyle, you know, what do we need to do? We need to reduce the weight, you know, as I said, increase the physical activity level. Do not sit. You know, one thing is, you know, do not sit. Do not keep sitting, you know, rather I should say. So the sedentary lifestyle is the biggest killer, you know. So just keep doing something, you know. If you don't understand, you know, what you need to do to keep your heart healthy, just keep doing something. Do not sit at all, you know. Just be on your toes, do something, you know. That's better than not doing anything. So now learn to dine out more healthy, because we often dine out, you know, but learn to dine out more healthy food and cook smart, you know, the food which is healthy for the heart. I'll tell you what is healthy for the heart. And you know, stop consuming junk food. We know that pizzas and pastas and, you know, whatnot we eat outside, you know, so that fried item, you know, is not good. The pizzas contain a lot of cheese, you know, that cheese is not good for the heart, you know. It just stuffs your arteries with the cholesterol. Now, you know, this is a chart that shows, you know, what needs to be eaten. I'll come back to this. For a healthy heart lifestyle, you know, first thing is that we need to learn to eat less, you know, and eat healthy, you know. So what we need to eat less is, you know, any food that contains high cholesterol, any food that contains saturated fat, any food that contains trans fat. I'll let you know what trans fat is, and food containing sodium, you know. So we should try to avoid these 4 things in our food. And what we should eat more is the food containing fiber and food containing soya-based products, you know. So, and eat less fat, avoid fried foods, the fatty meats and whole milk products, you know, that should be avoided. And what food contains, you know, more cholesterol, that should be avoided. You know, the cholesterol is found in foods from animals. So any food from the plants does not contain cholesterol. That's why the vegetables are very good if you're talking about the cholesterol content. They do not have any cholesterol. But fatty foods, the animal meat, chicken, mutton especially, you know, the fish, all have got cholesterol in it. So now the other thing is, have less of the saturated fat. So saturated fats are usually found in the animal products. You know. However, in the vegetables also, in the non-vegetarian food, you should avoid the coconut oil, palm oil, and the kernel oil, palm kernel oil, as they're very high in the saturated fats. Rather instead, go in for olive oil, um, which is low in the saturated fats. Avoid alcohol, as I said. Avoid sugar. Avoid all those candies, chocolates, and regular soda like Coke, Sprite, Limca, whatever that is. That contains very high amounts of sugar. So you are thinking in your mind that you are having only one bottle of Coke, but that bottle of Coke is really harmful. That contains very excessive amounts of sugar. Even you'll be surprised, the zero diet Coke, the diet Coke that they advocate, and that also contains high amounts of sugar. So these should be avoided at all costs. Eat fewer carbohydrates. Carbohydrates should be less in the diet, like breads, cereals, rice, pasta, and the dairy products. You should have less of that in your diet. Now, very important thing is, in the food, we should always avoid the trans fat. Trans fat is a very bad thing. So saturated fats and trans fats. Trans fats are even worse. We should avoid that at all costs. So any fried items, so you go to a shop, you see those fried, vegetarian as well as non-vegetarian items, they are very high in trans fat. Especially, they keep frying the things in the same oil. What happens is that that oil gets hydrogenated, and that turns into the trans fat, which is not a good thing at all for the heart. It just is a poison for your coronary arteries. So avoid all those packaged cookies, crackers, the baked goods, which are packaged, any commercially prepared fried foods, chips, donuts, all of that contains trans fat. That should be avoided at all costs. Why is the trans fat bad? Because it raises your bad cholesterol levels in the heart, in the body, and it decreases the good cholesterol. The LDL is the bad cholesterol. The low density lipoprotein is the bad cholesterol in your body. So it raises that bad cholesterol, and HDL is the good cholesterol in the body. You need to have higher levels of HDL in your body, but this trans fat reduces that, and it increases your risk of heart disease that way. So now increase the intake of fiber in the food. Your food should be fiber rich. And where does the fiber comes from? Fiber comes from cereals, from oats, barley, dry beans, comes from the peas. The fruits and vegetables are high in fiber, so they all help in lowering the cholesterol levels. So choose at least 4 or 5 servings of vegetables and fruits per day, or at least 2 servings of fruits and vegetables in a day should be consumed. And try to have whole grain breads, cereals, and dry beans, because whole grains contains a lot of fiber. So your food should be rich in fiber. Also, the fiber helps in preventing certain kinds of cancers also. So fiber is good in diet. It will give you good stool, good motions, will prevent the cancers and prevent the coronary artery disease also. So regular intake of fiber is very important in the diet. Now, a word about soya. The soya protein, there have been studies that say that soya protein is good for heart. It reduces the risk of heart disease. So add that soya to your diet. We Indians do not have that much of soya in our diet, regular diet, but I think we need to add that to our diet to have a healthy heart. So like the tofu, the soya nuts, the soya milk, or other whole soya products should be added to the diet. They're good for the heart. Now, very important thing is decrease sodium, salt intake. So salt, try not to add salt to your food. Whatever it's being cooked, just that. Don't add any additional salt to your food. your taste buds will get used to the low salt. If you're taking high salt right now, you start taking the low, do not add any additional salt. And I can tell you, in 3 months time, your taste buds will be used to that. You will not need any additional salt then, So salt should be low, because salt increases your blood pressure. And as the blood pressure increases, it increases the load on the heart. And the heart tends to become more hypertrophied, more thick, and tends to develop that coronary artery disease, So the sodium should be low, the salt should be low in the diet. Very important. Physical inactivity, as I said, any level of activity is good. If you don't, if there's a doubt about how much activity should we do. So just don't be inactive. Don't sit, as I said. Any level of activity is good for heart. And what works really is, at least 30 to 45 minutes of moderate exercise. What is a moderate exercise? Moderate exercise is brisk walking. If you walk briskly for 45 minutes, that is considered as a moderate exercise. If you do swimming for half an hour to 45 minutes, that is a moderate level exercise. If you do, work as like mowing your lawn, for half an hour, 45 minutes, that is a moderate level of exercise. So this moderate level of exercise is required for 45 minutes, half an hour to 45 minutes of exercise, at least 5 times in a week. If you do that, you keep your heart really healthy. And also, if you can combine that with the little bit of weight training, maybe twice in a week, weight training, you do 1 set of each exercise, each large muscle, 1 set, large muscle, and cover all the muscles twice in a week, that is good enough for you. Now, exercise alone will not lower blood pressure, but it will help control the body weight and make heart and circulation stronger. So the exercises recommended are walking, light jogging, bicycling, swimming, or playing games like tennis daily for 30 minutes. All of these can help. Now, stress management is very, very important. The stress is a major cause of buildup of these plaques. And, important things to contain the stress is, engage in exercises. As I said, moderate to strenuous exercises, at least moderate exercises, five times in a week. Engage yourself in the exercises. Exercise is good for the heart, good for the body, good for circulation. You name an organ, and it gets benefited with the exercise. Exercise also releases endorphins. These are the happy hormones. So you do exercise in the morning. Most of you would have experienced that. This exercise. If you do that early in the morning, 6 o'clock, get up, do exercise for half an hour, 45 minutes, and you can notice that the whole day is going good. You feel so happy after doing that exercise. Why is that? Because the body releases happy hormones. They release the endorphins. They keep the person happy throughout the day for at least many hours after the exercise. So, and that helps bringing the stress down. So regular exercise is very important too for stress alleviation. Now, second thing is the proper rest and sleep. It's very important to sleep adequately. People say that, I'm a short sleeper. I sleep for 4.5 hours, 5 hours. That's not correct. I think body needs certain amount of rest, and that rest should be sought. Adequate amount of sleep, at least 7 to 8 hours of sleep a day is very, very important. If you sleep less, your immunity goes down, and ultimately you can catch infections. You can also get, the plaque buildup if you sleep less. If you're diabetic, your diabetes sugars can go way off if you sleep less. So having adequate sleep is very important. Adequate rest is very important. Now there are mind relaxation exercises. You can go in for that. Yoga is very good. Art of living exercises. They're very important. Some form of relaxation exercises. You can find multiple relaxation therapies. You can choose any one of those. And then, of course, the family and social support is so important. Engage yourself in social activities. And I'm sure, people like you, are, will have that this part very strong, because you are a social group, really active with the social activities and all that. So it's very important to get engaged in the social activities, and that also reduces the stress dramatically. Now, yoga and meditation I already covered. What about diabetes? Diabetes create higher risk for coronary artery disease. Patients who are diabetics, they die from the 65% of diabetics die from heart disease or stroke. So you can imagine, diabetes is such a bad thing, in the context of cardiovascular and cerebral health. India is already a diabetes capital. We've got so many diabetic patients in our country. Now, poor control of concomitant risk factors in diabetic patients is a major challenge. So one of the studies showed that 31% of the participants, diabetics, they achieved the target goal of HbA1c. This is a marker, for chronic diabetes control. Less than 7, which is the target. Only 36% achieved the target blood pressure goals. And more than half had very off cholesterol levels, more than 200 milligram per deciliter. What that means is diabetics often have other comorbidities which are poorly controlled. Something happened here in this.
In the options on the top, you can go and remove annotation. So in the presentation
options.
In the presentation options, go on the top of the screen.
Yeah.
On your top of the screen, where you see Zoom options.
Zoom.
Not
sorry.
here.
There. Annotate, yeah.
So remove, disable annotation for participants.
It's written here, eraser. Should I use that?
No, not here. Go to the top of the screen below your camera, and you'll see options for Zoom.
Options for Zoom.
View options.
Yeah, you will see view options and
view options.
More? No. Annotate. There is annotate there.
Yes, annotate.
Annotate is here, and
yes, there you will find the option clear annotate.
Clear annotate.
Clear annotate. There. Okay.
And
then
you can
all drawings.
Yeah.
It says clear all drawings.
Clear all drawings.
All right.
And you can disable annotation for participants. In that option, there is an option to disable annotation for participants.
Okay. Disable annotations
for participants. It's okay if it's not there.
Yeah, it's not there. Yeah, I can't see that. Okay. So, just to conclude, sorry. I'm not able to move the slides. Something happened after that annotation thing.
No issues. Just stop screen sharing and start once again.
Stop screen sharing. Stops. Okay. Stop share. Okay.
And then start again.
Okay. Share screen. And yeah.
Now it's moving.
Yeah, it is. Yeah. So just to conclude, the risk factor management, the cardiovascular disease begins in childhood and is strongly associated with major risk factors for heart disease. And the risk factors, as I enumerated, the diabetes, hypertension, dyslipidemia, I mean the high cholesterols, the stress, and sedentary lifestyle. These are the diabetes. These are the major risk factors for the cardiovascular disease. So there are multiple risk factors, and these are they all require more aggressive management. The aggressive risk factor modification is the most effective strategy for reducing the consequences of heart disease. So there mostly, we need to do the lifestyle modification in cases of newly detected cardiovascular disease. The important thing is the lifestyle modification, and it works in many of the patients. You don't need to start them on medications initially. Only the lifestyle modification will work. And if it is not controlled with lifestyle modification, then of course medications have a role. Even if the medications in a disease which is already built up in the coronary arteries, disease already which has progressed to more than 70% of criticality, in those patients we need to do the interventions in the form of stenting or a coronary bypass surgery, as we say. Now, how to suspect a heart attack? What to do if the heart attack occurs? So, important thing is immediate rest. You should not exert at all. Just lie down where you are and call, inform the family. Do not hesitate to call anybody. Call the nearest doctor or the hospital with the ECG facility. If you have the aspirin, chew and swallow the aspirin immediately. And don't take the baby aspirin. Take a full 325 milligrams of it. If you are already taking nitroglycerin, which was prescribed to you by a doctor, then take it. If you have not been taking nitroglycerin, do not take it. It can harm you more than any benefit. Don't waste time and call for help. So, as they say, stitch in time saves 9. The speed is the essence in stopping the heart attacks. The life-saving measures are only effective for a brief period of time after the symptoms begin, because by this time the heart vessel blocks and it causes the muscles, the heart muscles, to get deprived of the blood supply, and ultimately leading to their death of the heart muscles. And as the heart muscles die, the heart function goes down and the heart ceases to function. So here's the advice: just don't wait. Call for help. Thank you.
Thank you so much, Dr. Chandola. That was a wonderful talk. And I'm sure all the participants benefited a lot from it. Let's begin with the question answer session. I have a few questions from the presentation which I saw, and then we'll open up to the audience.
Sure.
Can you disable screen sharing now?
Yeah.
Yeah. So just first question which I was thinking was, in terms of a lot of times, what is the main symptom of a heart attack? Is it like you start sweating, or is it like a searing pain in the chest? How does one distinguish what is the main symptom of a heart attack, or how do we know it's heart attack?
Yeah. So heart attack, generally what happens is, if you are not a diabetic, I'll tell why I'm saying you're not a diabetic. So mostly the heart attack will present as acute chest pain, and that chest pain is mostly the precordial pain, what we call as slightly to the left side of the chest, and this pain often radiates to the arm. And generally there is a relationship with the exertion. Like, if you're walking, if you're experiencing pain in the chest, which often radiates to the left arm, you call that as an angina pain. That is very, very diagnostic of the anginal pain. The heart attack can be silent also. Like, patients can have a silent heart attack. The heart attack happened, they didn't even know that. And this especially happens in the diabetic patients. Diabetics, generally what happens is, the sensitivity to the pain is not that great. What happens is, the nerve endings that supply the heart, those nerve endings are diseased in the diabetics, so they don't perceive the pain. So heart attack happens, they don't have that pain. So you must have heard, people who go to bed in the night and the morning, they're found dead in the bed. So what happens is, they get a silent heart attack, massive heart attack, silent. They don't even experience the pain in that. So this happens often in the diabetics. But non-diabetics also can have the silent MIs. More often than not, heart attack will have excruciating chest pain that often radiates to the arm. There will be diaphoresis, there will be severe sweating, and extreme restlessness. People will be restless, dizzy, they can have giddiness, there will be diaphoresis, extreme sweating, and then of course chest pain with radiation to the arms. and hand. So these are certain symptoms. Some heart attacks, some patients do complain of the back pain also. Some of them will complain of indigestion and all those things, but they are less common. More common is the typical scenario where they have chest pain, precordial pain with diaphoresis and restlessness.
Okay, okay. So just to follow up on this, in terms of a lot of times we hear and read that if you are having difficulty climbing a few stories in a building, like a 2-floor, 3-floor, that is like an indication that you should go for a heart check or something. Any
Yeah.
such things would you like to throw some more light, which for a common man is an indicator that something is wrong and he
Yeah.
should?
Yeah. So, I mean, the coronary artery disease, the heart disease, generally what happens is initial symptoms are you are either having heaviness in the chest, especially while doing any kind of exertion, like you're walking, say 20 steps and you are starting to have that chest pain or heaviness, or you are experiencing any new shortness of breath, any breathlessness, which is in excess of what you would expect for your age. Say a 40-year-old man who used to walk, 3 kilometers, 4 kilometers a day without any significant shortness of breath. If you start experiencing that shortness of breath, which is new in onset, which is out of sync with your exercise capabilities, that means there is some problem. So either chest pain or heaviness or new shortness of breath. These are two important symptoms. You should definitely think about any existing coronary artery disease and go in for help. Your doctor would recommend you ECG, and he would also recommend an echocardiogram to see the function of the heart. And the ECG would tell any obvious changes in the coronary arteries, that any blockage in the coronary artery will be reflected in changes in the ECG. But as I said, many a times ECG will not reflect anything. But if the symptoms are persistent, you are saying that I am experiencing symptoms, but ECG is not showing anything. So in that case, your doctor will ask you to go in for an echocardiogram and a TMT. TMT is a treadmill test where you will be asked to do some exercise and your ECG will be taken, And while you are exercising, your ECG may show some changes, So many of these cases will be detected at the level of the TMT. But even if the TMT does not shows anything, you still have the chest pain, you still have the shortness of breath, then the doctor will recommend you an angiography. You have an angiography, and more often than not, the disease will be detected there. Yeah.
Thank you so much, sir. Let's proceed with the audience question answers. So Manish Bhartia ji is asking, does fruit contain sugar which could be harmful for diabetic patient?
Yes, it does. That's why, certain fruits, we have to avoid, diabetics also, there's a recommendation for what kind of fruits you can have. And certainly there, but for healthy non-diabetics, definitely any fruit is good. You can consume any fruit. It is very rich in antioxidant, very rich in fiber, and it is healthy for your heart health,
Okay. There's a question by Neha Sani ji. She's saying, sir, I'm 18 years old and I want to ask that I was admitted to a hospital due to a hole in my heart.
Okay.
Because of the whole blockage issue, can you tell me what precautions I should take for my health now?
Right. So hole in the heart, where is that hole? It all depends on that.
Sure.
Is that there are two types of things there, does she have an atrial septal defect? Is that what she's asking?
I can just ask her to unmute. Neha, can you unmute yourself and describe your condition? Neha Sani. We'll go to the next question, sir. I think
Sure.
when she comes back, we'll come back for the clarification.
Sure.
Then there is a question from Hitesh Gupta ji. Thank you, Dr. Chandola. What tests can individual above 55 can take as a precautionary or preventionary measure, even when they don't report any chest pain or symptoms?
Sure. So there is a comprehensive heart checkup, So we call that CCC, the comprehensive cardiac checkup. It is recommended that anybody above 45 undertakes this CCC. It's a very simple test. You just need to go to hospital, any hospital. I think most of the hospitals have got this test. So any hospital near to you, a good hospital with good cardiology facilities, you go in there and ask them for a comprehensive cardiac checkup. This checkup essentially involves the blood test, like mainly the lipid test. It will check your cholesterol levels, check your triglyceride levels, the ratio of the cholesterol to the triglyceride. It will also check your liver enzymes, liver function test, kidney function test, your diabetes. If you are pre-diabetic, it will check. So all these blood tests will be done, and in addition they will do a ECG and echo if needed, and that will tell the basics about your heart health. And if there is any change in these tests, you will be subjected, you will be advised to go in for further set of investigations. But a CCC, a comprehensive checkup, is a must for anybody who is 45, and we should keep doing that every 3 years or 5 years thereon. So it will detect the heart disease at an early stage. Yeah.
Got it. Thank you so much, Anuj. Next question is from Rajesh Jain ji. How much blockage does angioplasty require? And if the blockage can be removed by medicines when it is less than 80%?
Yeah. So a very important, good question there. I think the answer to that would be, we call blockage in the heart as critical if it goes beyond 70%. So if it is less than 70%, you will be kept on medications, and these medications can prevent the progression of the disease. They may not dissolve the plaque. There is no medicine available that can dissolve the already existing plaque. Once the plaque builds up, nothing dissolves it. There are claims on the internet that those all some people who claim that they are doctors, they claim that they can dissolve the plaques and all that. That is all eyewash. That's not correct. You will drain your money. You will spend lakhs and lakhs of rupees on that. That will drain you out. Nothing will happen. So don't go in for that. That's just a farce. The best thing is to the prevention. If you can prevent building of the plaques, and if it is less than 70%, the medical treatment works. You can stay healthy for a very, very long time on medicines if the disease is less than 70%, like the blockage is less than 70%. If it goes more than 70%, and if you're symptomatic because of that, that needs an intervention. And the intervention could be in the form of angioplasty if it's a single vessel involvement, or at the most double vessel involvement with small lesions. If there are big lesions and more than two vessels are involved, or if you are diabetic, in that case a bypass surgery is much better than angioplasty. The stents can block in months to years, but the bypass surgery gives you very good long-term results, So especially if the people are young, say if 45-year-old, 40-year-old person gets a heart attack and found to have a triple vessel disease, significant disease, it is always recommended to go in for a bypass operation, not the stents, because stents will definitely block in years' time, 2 years, 3 years, 4 years, who knows when. But the bypass surgery will last many years, decades. So the gold standard is the bypass surgery in these cases. Yeah.
Thank you, sir. The next question is from Manish Bhartiya ji. It's a question from Ashok Bidasaria ji from Patna, that his wife's problem, इनको गले में 2-3 महीने से कंजेशन रहता है और चेस्ट में भी भारीपन रहता है, लगता है दम घुट रहा है, सोने में दिक्कत है, बैठने में आराम मिलता है, गैस काफी रहता है. Any prognosis on this?
Yeah, so see, it all depends, they need to first go into a doctor who will do the basic checkup, and the ECG is very important here, and an echocardiogram. ECG and echocardiogram. If the ECG does not shows any signs, if the echo looks okay, heart function looks okay, then in that case, other things should be ruled out. Like she can have some dyspeptic symptoms, the acidity issues and all that. They need to be taken care of. But as they are saying that, she's not able to sleep in the night time, she has to often sit up, that needs to be investigated. Why is that happening? why she needs to sit up. Is it because of some congestion in the heart, congestion in the lungs, which is causing her to get up in the night and keep sitting? So this needs to be investigated. As I said, the first thing would be to get an ECG and an echocardiogram and rule out any cardiac cause. And once that is ruled out, then other things should be investigated. Yeah.
Sure. Thank you, sir. From Hari Krishna ji, sir, I would like to ask, what is the precaution for a senior citizen who has got a bypass surgery for 12 years ago? What tests and precautions we should take now?
Yeah. So, it's, as you see, he's got a bypass 12 years ago. And if the bypass is doing good, he has got a very good prognosis. All the grafts will be working good for many, many more years. And, all you need to focus is continue taking the medications that were prescribed. Do not stop antiplatelet medicines, first of all. Second, keep taking the lipid lowering medicines, because these grafts, when we do, they are also prone to developing that lipid. So continue taking antiplatelets, that is your aspirin or clopidogrel. Continue taking your hypolipidemic drugs. Their doctor must have advised some kind of hypolipidemic medicine, like Rozuvaz or Torvastatin, something he would have prescribed. Continue taking it. Do not stop it. Third thing is lifestyle modification. Very important. Keep doing exercise, manage your stress, and do not lead a sedentary lifestyle. Keep doing something. Be active, I think these are certain things that need to be done to manage your heart health, especially if you've got a bypass. Yeah.
Thank you, sir. The next question is from CA Vijay Kumar. Sometimes in case of anxiety, breathlessness is felt. Is there any relationship of such breathlessness with heart problem?
Yeah, so, this is fairly common, the anxiety can lead to breathlessness. It's a common salient feature of anxiety, people do get panic attacks also, and they feel that as if, they're getting choked, inability to breathe. So this is fairly common. And we do get many cases where, people think that they have got heart disease, heart attack, and actually it is not. What they are suffering from is severe anxiety, and those panic attacks are wrongly labeled as cardiac disease. Yeah.
Got it, sir. Next question is from Manish Bhartiya ji. Coronavirus is affecting majorly lungs or heart?
So it majorly affects the lungs, so lungs are the primary organ which are directly involved. It does affect the heart also. So many of these patients will go on to have the heart ischemia. What that means is some amount of reduced blood to the heart muscles, and as a result, their heart enzymes will be raised, So they can have heart involvement also, but primarily it's the lungs which are involved, And what we have seen is the patients who go on to require the ventilator, and the autopsies have been done in patients who have died of COVID. Their lungs were so bad, they were all destroyed, extensive, massive destruction of the lungs on both the sides. So that's a severe manifestation of COVID. While most of the patients who get infected with COVID, close to 97% of the patients will not have major issues, but 3% of the patients will go on to have that significant lung involvement that it leads to death. So those patients are found to have very badly affected lungs. The lungs are totally destroyed. Heart is involved, but no, that's not the major cause of mortality.
Next question is from Mr. Muli Saraf. Sir, is there some concern if pulse rate goes up while jogging or running?
Yeah. Sorry, I didn't get it.
Is there some concern if pulse rate goes up while jogging or running?
No, not at all. This is totally physiological,
So any limit, 150 or 160, it should maintain anything?
Yeah. So I mean, if you're jogging, walking, if your pulse rate doesn't goes more than twice of what it was at the rest, then it's fine. It's totally fine. And in fact, you should not bother about the pulse rate at all. Just don't bother about it. As long as it is regular, even if it is 150, 160, it does not matter at all.
Okay.
yeah, if it gets very irregular, it will produce symptoms. You will get to know. You will have palpitations. You will have restlessness. You will find extremely short of breath. All those things will happen if anything irregular happens. So don't count. I would say don't count your pulse while you walk or exert. Just go on with the flow. And if something is wrong, your body will tell you. Yeah.
Nowadays, so many people with fitness watches and everything, na,
I
keep
know.
heart rate, and as soon as it goes above 130, 140, there's a panic. And
Oh, no, not at all. Not at all. I think we should not wear those watches and all that. Just go and do the exercises. Yeah.
yeah. So next question is from BD Gupta ji. I am 65 years old, suffering from BP. I am also overweight. What exercise would you recommend to reduce my weight and reduce my BP? Also,
Yeah.
how prone I am to a heart disease?
Yeah.
So shall I repeat the question? Participants, just keep us in mind. We'll just reaching out to sir for connection. Yeah, we just spoke to sir. He's just logging in a minute. Some connection issues. Just bear us with it for another minute.
Hello. Hello.
We can hear you now, sir. We can hear you now.
Okay. Yeah. I'm so sorry. I just missed that question.
I'll come back to the question, sir. So
Sure.
the question is from BD Gupta ji that I am 65 years old and suffering from BP. I am also overweight. What exercises would you recommend to reduce my weight and my BP? And how prone I am to a heart disease?
Right. So at age 62, I would also like to ask him, is there any family history? Like parents did have any heart ailment before? If there was a history of family disease, like heart disease in the family, like parents or, some uncle, or grandparents were having any heart attack or any unexplained death, so then there is a risk involved. And of course, that age 62 years of age, the history of hypertension and being overweight also predisposes you to the heart disease. But there it's totally preventable. So now the important thing, as I said, would be exercise. He needs to exercise, a lot to
BD
reduce
Gupta
the
ji
weight.
just replied that there's no family history, sir. BD Gupta
No
ji just
family. That's good. So that's good. I mean, he is relatively healthy, except that hypertension and overweight. So he needs to control both of these factors. Now, a good way to check the blood pressure is, to start doing exercise, take as less salt in the food as possible. Start doing exercise. Start with small exercise first. So say for first 15 days, just walk for half an hour. Normal walk. That's not very tedious. Anybody can do that. So once, after 15 days, you step it up. You ramp it up to 45 minutes to 1 hour, and just do the normal walking. After a month or so, then you start doing brisk walking, like walk fast, walk fast. And brisk walking is a very good exercise. 45 minutes a day of brisk walking for 5 days a week, that will keep your heart really, really healthy. That will help prevent buildup of cholesterol in the heart vessels. So this is what is recommended. And then in addition to that, just take as less salt as possible. Control your blood pressure. Check your blood pressure. Take a blood pressure machine. Buy a blood pressure machine at home, and just check your blood pressure every morning. Once you get up before breakfast, just check your blood pressure and maintain the blood pressure less than 130/90. Start exercising. If your blood pressure comes down on its own after a month, 2 months of regular exercise, that's great. You don't need to take any medicine. But if it doesn't, then in that case, consult a doctor and try to bring that blood pressure to that level. 130/90 is the mark. You have to keep it down that, below that. And it will happen, most of the patients will have good control of blood pressure with exercises, stress management, yoga, meditation, exercise, less salt intake. That will do the trick. And please do not engage in smoking or alcohol. You are taking that. No, smoking is bad. Yeah.
Sir, the next question is from Deepika Agarwal. In case if no dinner in night, you feel easy throughout the night. So should we avoid dinner at night or have a light diet?
Yeah. So it is recommended that to have a light diet. So 3 meals in a day are really important. Have a good breakfast. Have relatively lighter lunch, and a light dinner. That is the dictum. And take your meals in time, like pace it out in such a manner that you have the breakfast early morning, 7:30, 8 o'clock. You have a breakfast. You have your lunch by 12:30, 1 o'clock, and have your dinner 7 o'clock, 7:30 in the evening, and go to bed early. You rise early and do some exercises. Well, these are the ideal recommendations. Most of us are not able to follow that because of our work schedule and the other constraints. But if given a chance, I think we should practice these healthy heart regimes.
Got it. The next question is from Thamrai Selvi. Left ventricular hypertrophy. Can it be cured by some sort of medicine like Siddha or homeopathy? And what is the relapse?
So we should not look at left ventricular hypertrophy in isolation. Why the left ventricular hypertrophy happens? What that means is the muscles in the left side of the heart have become thick, and this happens mostly because of the high blood pressure. So if you have the high blood pressure for a long time, your left side of the heart will become hypertrophied, will become very thick, and as a result, you can have later on, scarring in the heart also, So, but then the good way to reduce that hypertrophy is to take low salt in the food. Also, to control your blood pressure very effectively. And third is to take some medicines that can reduce the afterload on the heart. There are certain medicines which can reduce the afterload, and as a result, the pumping of the heart becomes much more easier, and that will lead to reduction in thickness of the heart. So, mostly what I am advising is non-medical treatment. I'm not saying you take medicines for that. Simply, if you can avoid taking more salt, do control your blood pressure, and maybe if your blood pressure is controlled, if your blood pressure is less than 130/90, then you don't need to take any medicine for that. But if despite all the measures, if your blood pressure doesn't come down, then you start taking some afterload reducing medicine. Your doctor would probably know what those medicines are.
हाँ भैया, नेक्स्ट है मैसेज राजेश जैन जी से. सॉरी, एक सेकेंड, जस्ट अ सेकेंड. रिंकी गुप्ता जी से, alkaline water is said to help fight cancer and other diseases. What precautions should we take and how helpful is alkaline water for heart?
See, there are no randomized controlled trials so far that can validate this statement. We only go, a very scientific stream, and we don't recommend anything which is not evidence based. And what is evidence? We have the evidence only if there are randomized controlled trials done. If they say, trials are done where, they take 1,000 people who have taken alkaline water, and 1,000 people who have not been given alkaline water, the same kind of the baseline characteristics, So, and then they follow up these patients for years together to see which patients get benefited, which not. And if it shows that alkaline water really is helpful for the heart, then that's called evidence-based medicine. So there is no randomized controls trials so far. So any claim which is done to this effect is not correct in my opinion. Yeah.
Next question is from Hemant Shahji. How many stents a person can have?
Well, the ideal is, stenting normally is recommended for patients who have got 1 or 2 arteries in the heart blocked, and those arteries should be blocked, like the small segment needs to be blocked. Like if there is a discrete lesion, very small lesion, and only 1 or 2 arteries are blocked, then they can have 1 or 2 stents. But if it requires more than 2 stents, probably that's not correct, because why are you requiring more than 2 stents? The more stents you have, the more are the chances that one of those will get blocked, and then you can have trouble, So that's not correct. You should not have more than 2 stents. Sometimes you may need up to 3 stents. There, I have heard, and I know some of the patients who have got close to 6 stents, 7 stents also. But that's not correct. That can be done only in the situations where the surgery is not an option. Like patient has got too many comorbidities. If we try to do, or the surgical risk is very high, those patients it can be tried. But most of those patients do not fall in that category. And remember, surgery gives much more longer lasting results as opposed to the stents. Stents may last for months to years, maybe 2 years, 3 years. Some of them may last for a little longer also, depending upon, for what was the indication of the stent placement. But the surgery invariably lasts for many, many years, for decades. So surgery is the gold standard. And, any time when more than 2 stents are needed in the heart, that's not a good situation, Then multidisciplinary discussion should happen. Treatment with the the discussion with the surgical team should happen. And the advice from the surgical team should be sought in such a situation. Yeah.
So next question is from Vijay Sarabji. My blood pressure in normal course is 140/100. Any precautions to take as it is above the 130 level? 130/90 level?
Yeah. See, what is his age?
Vijay Sarabji, I'll just... Vijay Bhai, can you unmute yourself?
Yeah, 50 years.
50 years.
Okay. Right. So 50 is not that old, we are all, like, yeah. So, and 140, and what is the lower one?
100.
100. 140, 100.
Yeah. It's a little high, just a little off, but it will happen, once you start exercising and you avoid the sugar, the salt, start exercising, some stress relieving exercises also, meditation, yoga, and you will see a great benefit. Your blood pressure will come down because it's just a little off, it needs to come little down than that. And even with that, if you don't find, maybe after 3 months, 4 months, the blood pressure is not budging from that number, then in that case, just a little bit of medicine, maybe one medicine will do the trick, and that will bring your blood pressure to the required level. Yeah. But keeping that high blood pressure for a longer time puts strain on the heart. The left side of the heart, the muscle starts to hypertrophy, and as a result, the coronary arteries also start to develop the blockages there. So it's important to aggressively pursue the blood pressure.
Thank you, sir. Next question is from Vinod Kataria ji. Sir, my HbA1c is 6.2. Any precautions to take?
It's perfectly fine. HbA1c 6.2 is very good. Yeah.
Great to hear that, sir. Next question is from Redmi to everyone. Dr. G, what is the range of normal BP and sugar, fasting and PP?
Yeah. So normal BP, I have mentioned, 120/80 is the normal ideal blood pressure that should be. 130 to 140 is your blood pressure. If the systolic blood pressure is between 130 to 140, it's marginally raised. If it is more than 140, then it is hypertension. And the diastolic pressure, the range should be less than 90. 80 to 90 is marginal, and more than 90 is hypertension. So you should try to keep your blood pressure less than 130 to 90, as I said. Blood sugar, the range, yeah. The blood sugar, yeah. So blood sugar range, so there are different units for the blood sugar levels. It could be in milligram percent, it could be in millimoles. There are different values for that. And generally, if you keep your fasting blood sugar less than 110, 100, that's fine. That's perfectly fine.
Great. Kema Gawalji has another question. With age, does the BP limit go up?
Yeah, that's correct. So a person who is 70 years old and is reporting a blood pressure of 140, 145, I would label that as normal. Not bother about that. But a younger person who is 40 years old, 30 years old, reporting a blood pressure of 140, there's a problem. So with age, the perceived blood pressure, the accepted level, the accepted range of blood pressure is different. Younger patients, as you grow old, your vessels become less elastic. The vessels are very elastic. When you're young. As you grow old, more and more fibrous tissue accumulates in the blood vessels. Your vessels become less elastic, and as a result, your blood pressure shoots up. So the accepted level of blood pressure is different for all the ages.
Got it, sir. And last question is from Kemagwal side. Uncle is asking that sugar feud is randomly. If it comes up to 200, is it okay?
I mean, on few occasions, if it comes to that level, but mostly if it remains in the acceptable range, that's not an issue. And especially if your HbA1c is within the normal limits. So how we do it is, the HbA1c is one marker which will measure your how well is your blood sugar maintained in last 3 months, 4 months time. So if your blood sugar is maintained quite nicely in last 3 months, your HbA1c will come low, less than 7 probably, which is good. If it comes more than 7, that means that it's more often than not uncontrolled. So you have to believe in your HbA1c. I think the recommended thing is to go in for HbA1c at intervals, like every 3 months, 6 months. You should get your HbA1c and see how well your blood sugar was maintained in last 3 to 4 months. And certain occasions, blood sugar going up to 200, is not a major issue. But mostly, most of the testings, most of the blood sugar measurements should report the blood sugar in the normal ranges.
Yeah, Neha ji, could you unmute yourself and ask your question?
Sir?
Yeah, please go ahead, Neha.
जी सर. सर, मेरी डॉटर
Yeah.
को आर्टरीज में कॉन्टिनेंटल में होल है, जिसमें कभी कभी
Yeah, Neha ji, go ahead. It's okay. We'll take it later on. Apologies for that. Some connection issues. We'll take it offline later on. So next question again is from Pawan Goenka ji. Is green tea or black tea good for heart and health? Does it reduce weight in any way?
Yeah. Well, I mean, green tea is good. Again, if it does not contain any sugar, it is good. If you take the black tea also, you add some lemon to that and drink that, I think that's equally good, you know. So as I say, you know, there are no randomized studies to claim any benefit, but yes, it is considered healthy for heart. Yes.
The question is from Adarsh ji. What is the normal BP and sugar level for 62 years old who is a BP and sugar patient?
Yeah. Normal BP and sugar level?
Yeah, for a sugar and BP patient, 60 years old.
Yeah. Yeah. So the range is almost the same as it is for the healthy people. You know, at at the age 60, your blood pressure should not go more than 135, 140. You know, and the systolic, the upper level, you know, the lower level should not go more than 95 to 100. You know, that should be the range. And the blood pressure, of course, your fasting. Is it diabetic? Is diabetic, right?
Yeah, yeah.
Yeah, yeah. So I mean, the fasting should not go more than 110, 120, you know, and you should try to keep HbA1c less than 3, less than 7, you know, keep checking HbA1c every 6 months, every year, and try to maintain HbA1c less than 7. The chronic glycemic control should be very good. That's the idea. So one off value probably is not that important, but chronic maintenance on multiple levels whenever you check the blood pressure, blood sugar, you know, it should be showing you the value in range, and HbA1c should be less than 6.5 to 7. You know, that's the ideal.
Thank you, sir. Whether Vijay Kumarji is asking whether thyroid in the long run affects heart function anyway.
Thyroid?
Yeah, whether thyroid in the long run affects heart function anyway.
Yeah, it does. It does. Actually, if there is, so thyroid, we can have two problems with the thyroid. Either the thyroid hormones are low in amount, which is called hypothyroidism, or they could be high in amount, which is called hyperthyroidism. So if there hypothyroidism is there, it can have an effect on the heart. It can cause the heart to beat less vigorously. You know, it can cause bradycardia. It can cause less vigorous beating of the heart. If it is hyperthyroid, it can cause more tachycardia. It can cause some arrhythmias. Heart can have some arrhythmias, can have some irregular rhythm in the heart that can ultimately lead to dysfunction of the heart over a long period of time. So yes, thyroid abnormalities can have an effect on heart, and but they are easily controllable. You know, if it is hypothyroidism, we take the medicines. Many of the patients are on that, and the thyroid levels remain okay.
Manish Bhattiji is asking, my mom's blood pressure has fluctuations. Lower one goes to 50 and upper one goes to 180. What should we do?
Yeah. Yeah. So I mean, 180. I mean, again, depending upon age, you know, what her age is, 180 seems to be a little high, and you know, why the lower one is low, that needs to be investigated. You know, we should also get one echocardiogram for her to know whether she's having any problem with her valves. Sometimes if there's a leakage in one of the valves, that can lead to the lower side of the pressure go down. You know, like normally it should be around 80 or 90. Why is it 50 or 40? You know, sometimes there is a leakage in the valve that can lead to that. So all these other, or maybe, you know, if her hemoglobin is low, that can also lead to lower part of the the diastolic pressure go down. You know, so or if she's on some medication which can cause the blood vessels to dilate, that can cause lower side of the blood pressure low. So all of these things need to be investigated, and it can easily be controlled. You know, the upper level of the blood pressure is 180, that can easily be controlled. I think what she needs is a good doctor, I think.
Friends, we'll be taking the last three questions now. So the next question is from Abhishek Gupta ji. My mother is 60 years old and does not have any history of illness. However, recently she wakes up all of a sudden at night with a choking feeling and suffocated. What could be the reasons for this, and what measures can she take?
Yeah. So I mean, this choking could be anything. As I said, this could be pure anxiety leading to this. Maybe some stress recently, which has led to buildup of anxiety. The people who get panic attacks at night can have this kind of problem. Some people have got obstructive sleep apnea, OSA, we call that. You must have seen some people snore, at night, they have a tendency to have the obstructive sleep apnea. And generally, as your age goes up, the symptoms become more prominent. So at 40 years, 30 years, those symptoms may not be there. But as you age, you reach 50, 60, 70, those symptoms start building up. So this could be obstructive sleep apnea also. And she needs to see a doctor, and they will be able to diagnose exactly what we are dealing with, because the symptoms need to be understood better. Like there are multiple questions that we need the answers for. Like we will ask patients so many things and ultimately derive at a diagnosis. But to me, it looks like this could be very well be a anxiety driven thing or obstructive sleep apnea as they are describing it. Yeah.
Got it.
But we need more information on that. Yeah.
Sure. Second last question from Deepika Halalka ji. Can heart problem be a hereditary disease? And what precautions should be taken by family members to prevent themselves when their parents or elderly have hereditary disease?
Yeah. So is that Anand Halalka? I think one of.
Yes, Deepika is his wife, my cousin sister.
Okay. Yeah, I remember. One of my patients I operated.
Yes.
I think last year. Huh? Okay.
Yes.
Okay. Yeah. So, so the question was, the hereditary, the genetic.
Yes. What should children do? Yeah, when parents have heart problems.
Right. So there is a strong link, in terms of the heart disease. If the parents have got the heart disease, the children definitely have much higher risk of having the heart disease. So importantly, the first thing to do is, as you reach 40, you get a heart checkup, the CCC, the comprehensive cardiac checkup. You get it done, and ensure that your lipids, your cholesterol, your triglycerides, the ratio of the good cholesterol to the bad cholesterol, they are all within normal range. That is one thing. Second thing is your other organ functions are doing good. Liver function is good. Kidney function is good. Your hemogram is good. Then your ECG looks good. Your echo looks good. If all these things are good, and your exercise capacity also needs to be looked into. If all of that is good, if your comprehensive cardiac checkup is good, then you're good. All you need is good exercise, healthy eating, stress-free living, though it is difficult to attain. But the measures that we have mentioned, you need to follow all of those things, and you're fine. You just need to be aware that you are at relatively higher risk, for which you have already done CCC. You know that you don't have any underlying disease as such. So you don't have to worry too much about it. That higher risk means that slightly higher risk as opposed to somebody who doesn't have a familial disease. But actually your chances of having heart disease are it's not that it's too high. What I mean is, if a normal person in his 40s has got 1% chance of having a heart disease, your chances will be 1.5%. That's it. So not much difference between 1 and 1.5%. But yes, you need to be aware that you need to get yourself screened early on. Yeah.
Wonderful memory, sir. First of all, to remember patients after seeing thousands of patients. The last question for today, Piyush Mahavarji. I am 28 years old, having high BP at 150/80 since 6 to 7 years. Under medication since 5 years. Main reason is hypertension as per doctor. My job is a bit stressful. What advice would you give me?
Yeah. Sorry, how old is he?
He is 28 years old, having high BPF 28 years.
Mm-hmm.
and high BP of 80/150 since 7 years, under medication for last 5 years, and main reason is hypertension as per doctor, and his job also is quite stressful. So what
Okay.
advice would you give him?
Yeah, first of all, that's a relatively young age. 28 is quite young. So, there are a lot of modifiable risk factors, and we need to modify those risk factors. It's not recommended for him to take medications at that early stage. If he can get, blood pressure, as he's mentioning, 150/80, little high, but I think that can be controlled with exercise. Give time to your life. I think that's the only message. Give time to yourself. Once you come back home, just forget about the work. Just give at least 1.5 to 2 hours to yourself in the evening. Out of that, 45 minutes of moderate exercise, combined with that with 2 days a week of vigorous exercise, which includes some little weight training. You're 28 years old, you can do some weight training also. So combine that with some weight training, and then also engage yourself with social activities. Be more social. Talk to your friends. Conduct those Zoom meetings with your friends. These times are stressful. Keep talking to your friends. Watch movies. Engage in social activities, and also do some sort of stress relieving exercise, be it meditation, be it yoga, some art of living, whatever you like. You just engage yourself in something and find a hobby. I think these are the things that you need to do. Your blood pressure will come down with these measures. And stop eating, the fatty foods. Include good food, as I mentioned in my talk. Include all of that food in your diet. I think that's all you need to do.
Thank you so much, sir. We're done with the questions. Thank you for so much patience throughout the session for answering the questions. And thank you to 3 NGOs, CA Forum, Roundtable India, and Perfect Foundation. Would like to invite LD Saraugi ji for the vote of thanks. LD uncle, could you please go ahead?
Good evening.
Hi, good evening.
Hi.
अंकल बोलिए, आपकी आवाज आ रही है?
सबसे पहले आप सबको स्वतंत्रता दिवस की शुभकामनाएं, बहुत बहुत बधाई।
जी, आपको भी।
आज का जो सेशन एक इतना अच्छा इंटरैक्टिव सेशन बन गया कि जो क्वेश्चन आंसर अभी आशीष जी पूछ रहे थे, जिन्होंने पूछा उनको बेनिफिट तो हुआ ही, सभी पार्टिसिपेंट्स को भी इतना बेनिफिट हुआ जितना पिछले 20-30 साल में मेरा ख्याल है ज्ञान नहीं हुआ। हर्ट क्या चीज है, क्या क्या प्रॉब्लम आती है, कैसे कैसे आगे बढ़ना चाहिए, क्या क्या ध्यान रखना चाहिए। मैंने अपने 65 इयर्स के अंदर भी इतना ज्ञान प्राप्त नहीं किया जो आज की वेबिनार मीटिंग में किया है। और इतनी इंटरैक्टिव सेशन हुआ है कि 1% कोई आंख झपकना या बोरियत वाली वेबिनार नहीं रही। ऐसा लग रहा है ये 1 घंटे और भी चलती रहे तो शायद हमें पूरा स्वास्थ्य के प्रति ज्ञान हो जाता। और ये सेशन एक इस चीज का भी पार्ट बन गया कि आज के दिन एक डायलॉग चल रहा है, जान है तो जहान है। ये पूरी दुनिया में यही डायलॉग, हमारे प्रधानमंत्री जी का भी यही डायलॉग। कोविड-19 को देखते हुए इस सेशन की और भी महत्ता बढ़ जाती है। इसी कड़ी में मैं हमारे सीनियर डॉक्टर राहुल चंदोला जी का बहुत बहुत धन्यवाद करना चाहूंगा, जो रिनाउंड हार्ट स्पेशलिस्ट मैक्स हॉस्पिटल साकेत में हैं, जिन्होंने अपना इतना अमूल्य समय निकाला और हमें हमारा ज्ञानवर्धन किया, हमें बहुत कुछ बताया। और आशीष जी के इतने क्वेश्चंस का इतने बेहतर ढंग से आंसर क्वेश्चन दिया, बताया हमें कि बहुत बीपी वगैरह कितना कैसे रहना चाहिए, क्या होना चाहिए, सब चीजों के बारे में बताया। इन्होंने इतना समय निकाला, आपका डॉक्टर साहब बहुत बहुत धन्यवाद। और हम ऐसा ही उम्मीद करते हैं कि आपका समय समय पर हम सबको सहयोग मिलता रहेगा। और एक और निवेदन रहेगा कि हॉस्पिटल में भी हमें इसी तरह इसी लैंग्वेज में सब कुछ समझा दिया करें आप, तो और भी अच्छा रहेगा। डॉक्टर साहब का बहुत बहुत धन्यवाद।
जी जी जी, मैं भी आप
जी
मैं आप सभी लोगों का हृदय से धन्यवाद करना चाहूंगा। मुझे मौका आप लोगों ने दिया आप लोगों के बीच आने का, और हमारे किला साहब और आशीष जी को खास तौर से मैं जो है इसका धन्यवाद देना चाहूंगा, पूरे सीए फोरम, और जो आपके जो ये जो एनजीओ है, मैं काफी प्रभावित हुआ इससे, जो अच्छा काम कर रहे हैं जो है स्कूल में एजुकेशन के लिए। और हमारी तरफ से हम हेल्थ में क्या कर सकते हैं, अगर मेरी किसी भी तरह से कोई हेल्प की आगे जो है जरूरत हो तो मैं हमेशा इसके लिए तैयार रहूंगा। और किसी भी सजेशंस के लिए आई मीन आप मुझे संपर्क कर सकते हैं। और मैं जो है आगे भी आपके बीच में आना चाहूंगा। किला साहब से मैंने यही बोला है कि इस तरह के इंटरेक्टिव सेशंस के लिए मैं आने के लिए पूरी तरह से जो है तैयार हूँ। आगे भी जरूरत पड़ेगी तो मैं जो है आप लोगों के बीच में आऊंगा।
बहुत बहुत धन्यवाद।
डॉक्टर साहब के बारे में एक चीज और बताऊं एलडी साहब, ये डॉक्टर साहब चैरिटेबल सर्जरी मैक्स में होते हुए भी 50-100 सर्जरी फ्री की करते हैं। और जब भी बात होती है तो क्या बोलते हैं कि मेरे पेशेंट्स को मैं क्या बेनिफिट करा सकता हूँ, क्या खाना खिला सकता हूँ, क्या रहने का इंतजाम कर सकता हूँ। आज एक प्राइवेट हॉस्पिटल में करके इतनी जो आप आज बातचीत सुन रहे हैं ना, वैसे ही ये डॉक्टर साहब हॉस्पिटल में भी वैसे ही बात करते हैं कि भाई मैं कैसे सबको एक्सप्लेन करके कैसे उनको फ्री में सर्जरी कर दूं। अपने मैनेजमेंट से भी क्या कहते हैं कि मैं पेशेंट से कम पैसा कैसे लूं। वो एक डॉक्टर साहब की खासियत है। और गरीब लोगों के लिए तो हमेशा तैयार रहते हैं कि मैं इनकी कैसे सेवा कर सकूं। और ये अपने हमारे उत्तराखंड के जितने हॉस्पिटल है डॉक्टर साहब वहां भी जाके सर्जरी वगैरह करते हैं। तो मैं तो रियल में जिंदगी में इनसे बहुत प्रभावित हूँ डॉक्टर साहब से, जो ये गरीबों की सेवा में अपना ध्यान लगाते हैं।
ये तो किला साहब का सहयोग, जी किला साहब का सहयोग और आप जैसे लोगों का जो है साथ है हमारे साथ, इसलिए हम लोग कर पा रहे हैं और आगे भी करते रहेंगे। और आप खुद इतनी बड़ी सेवाएं कर रहे हैं जो है मरीजों को जो है खाने से लेके रुकने से लेके, और जगह जगह आप जो है जहाँ पे भी चैरिटेबल जो है जो जरूरत पड़ती है आप अग्रसर रहते हैं। मैं आपसे काफी प्रभावित हूँ।
बहुत बहुत धन्यवाद, बहुत अच्छा लगा।
आशीष जी, एनी लास्ट कमेंट्स? जो क्वेश्चंस आज रह गए पार्टिसिपेंट्स एंड मेंबर्स एंड फ्रेंड्स, आप डॉक्टर चंडोला जी को रीच आउट कर सकते हैं मैक्स में, एंड ही इज ऑलवेज रेडी टू आंसर देम। आशीष जी, एनी लास्ट कमेंट्स?
Nothing, sir. And we are very thankful to each and everyone. Special thanks to our Dr. Sahab, Dr. Rahul Chandola ji. And many participants asked me about the recording of this session. I would like to inform that recording of this session will be available at our YouTube channel. And link of the YouTube channel has been given in the chat box. And the name of our YouTube channel is the CA Forum. You can check recording anytime there. And in the below the YouTube video, you will find the link where you can get the PPT of this webinar also. So we are always available with the recording of this session along with the PPT of this webinar.
Thank you, sir.
Thank you so much, sir. Thank you so much, everybody. Thank you, Dr. Saab.
Thank you.
Thank you, everybody.
Thank you, everybody.